So we already talked about doctors, medical specialists, and of course the battle they're in right now with the government over Bill 106. Not news to report there, but more troubling news in terms of the number of patients, cancer patients who are still waiting to be seen. That number is over 4,500. And as I said just before we went to break, the troubling part beyond just the number of patients is the fact that 10% of them are facing delays beyond what is considered acceptable. I want to address that and then talk about the other situation with younger patients and cancer diagnoses with Gerald Batist, Dr. Gerald Batist, who's the director of the Department of Oncology at the Jewish General Hospital and, of course, the McGill University Center for Translational Research in Cancer. Jerry, thank you for being here this afternoon. Look, I couldn't think of someone better to ask, but I want to get your take on this. When you hear 4,500 people are on waiting lists and 10% beyond what's acceptable, how do you begin to explain this? I mean, where's the rationale and why this is happening?
Oh, well, first of all, it's very nice to be with you. It is alarming, and it's a problem that's been growing. Some of it was predictable coming out of the pandemic, but then the pandemic lasted longer than anyone imagined and had lasting impact on personnel that was hard to predict as well. So we have both an increase because of delays in screening during the pandemic, and then we have a general increase in cancers that particularly in younger age groups. And at the same time, the system is lacking personnel. And in general, I think it's a cross-Canada problem. It seems very, very fragile to all of us.
You know, I guess when people hear a story like this and read the details, you know, with respect to how things are working on the ground, how much of this has to do with what's happened in the medical system and the discussions, doctors, medical specialists, et cetera? How much of that works against patients here?
Well, ultimately, the patient is the goal, the most important person in the whole thing. The healthcare providers feel like it's working against them because we're all working, I must say, under enormous strain and pressure. The nurses, physicians, pharmacists, everyone, the clerical staff. But ultimately, we're there to make sure that the patients get the best care possible in a timely fashion, and time is extremely important. So ultimately, it puts the patients at risk, and we all work very, very hard to mitigate against that and to make sure that our patients do well. But it's a big challenge.
Yeah, well, the government pays lip service to that, right? The fact that, we understand patients are waiting, but I guess my question is, in terms of being on the ground, right, part of the complaints I hear from time to time from medical specialists are the fact that, we're paying too much attention to other things that don't directly affect patients. Is it the same with cancer care?
I think perhaps. I mean, I think even in the worst time of the COVID pandemic, 4 times as many people died of cancer than as they did from the virus, and so cancer is an emergency. It's a crisis, and it's a crisis that people in their working years, productive lives, are dying. It's a crisis that people at any time in their lives, and somehow we've come to accept that this is sort of par for the course. But now we have new and better therapies. We know that patients, if they're treated properly and timely, they do much, much better. And that's what the data is telling us, that the outcomes are much, much better. But the incidence is rising, and that's putting a strain on the system, and we're actually cutting back on resources.
So when you say cutting back, you mean by virtue of government funding or lack of?
Exactly. I mean, we're facing cutbacks in all of the hospitals.
Yeah.
Now, the idea is to be more efficient, but when you're more efficient, you usually end up saving costs. But if your goal is to save costs, it usually doesn't end up being all that efficient.
You alluded to, and I mentioned this off the top, this idea of more cancer diagnoses in general. You mentioned the pandemic, but the story I read said patients under 50, right, being diagnosed with cancer is on the rise. And I know you can't necessarily put a finger on why you think this is happening, but why do you think that generally overall, you mentioned cancer is still, very, very prevalent? A lot of people think, wow, we have all these new, cancer treatments and therapies
Right.
And cures. How can this still be happening?
It's interesting. For many years, we debated, should we focus on prevention or should we focus on treatment? And the idea was we chose the latter. And the most recent Canadian and American Cancer Society and even European Cancer Society data show us that these new treatments that we're generating very rapidly are having an impact. People are living longer and much better after a diagnosis of cancer. We're curing some patients who even have metastatic disease, yet the incidence of new cancers keeps rising. So we have to go back to prevention, and that means looking at the community at large, figuring out ways of identifying people at risk, catching them early, because what we're seeing worldwide is people under 50, even under 40, with increased cancers, colorectal cancer, pancreas cancer, but even prostate cancer, breast cancer, presenting at a much more advanced stage. These are not, as we used to think of young people, hereditary cancers. These are cancers with an unknown cause. And everyone in the world, all of the scientists are looking at that. And it may be that we're seeing the impact, finally, of environmental exposures, microplastics, all of those kinds of things catching up with us. That's not clear, but that's one of the suppositions now.
I realize, we can't necessarily put a finger on exactly what it is. You mentioned microplastics. I mean, my next question was going to be, is it environmental? Is it how we're eating, how we're living? I mean, can you sort of whittle it down a bit or not?
No, I think it's all of those, very likely. For the first time at the American Society of Clinical Oncology meetings this past year, we saw a randomized clinical trial in which patients who had a structured exercise program did better, even while getting the same chemotherapy. Their survival was improved compared to people that had no particular exercise program. Likewise for diet. So lifestyle is important, and our exposures in that lifestyle. So we know about cigarette smoking, but there are all kinds of other exposures that we've grown used to, and they probably are not healthy for us. And this is worldwide. So all of these things are being investigated, but at the same time, we should be reaching out into the community, not in the hospital, into the community to identify high-risk groups early so that we can screen them and get to them early and hopefully cure them.
I'm just curious, as a physician, when you talk about we can't put a finger on one specific thing, it's a little bit of everything, as you just said. Mm-hmm. Is it somehow, I'm trying to find the right word here, but to know that the message perhaps is not getting through to people, despite the fact we know that if you do this and if you do that, your chances of getting cancer are reduced. Do you feel the message is not getting through?
Well, it probably isn't getting through enough. We did it very well with smoking. We know that, for example, something is obvious to us now, smoking, whenever we did concerted campaigns and governments spent money in anti-tobacco campaigns, smoking went down and lung cancer incidence went down. So it's an active thing. It's not just a one-off interview or communication. There needs a budget for that, and we need to be looking at all of this and working on it on an ongoing way and communicating it regularly.
What do you say when we say people under 50 being diagnosed more often and you're starting to see more and more of this, what's your message to them generally?
Well, I think, the same kind of message, during the pandemic, young people were specifically made to feel very immune and very immune to these kinds of things. And I think people have generally come to think of cancer as an older person's disease. That's no longer the case. Yeah. And again, it's a communication. We have to get people to look at symptoms and not pass them off, but look at them and explore them, talk to their doctors. We also have to sensitize family doctors. The frontline physicians have to start thinking about cancer in young, evidently healthy people, because that's where it's starting to pop up.
I will leave it at that. Always appreciate your time, Jerry. Thanks so much.
My pleasure.
Take good care. Dr. Gerald Batist, I call him Jerry because we went to school together, Director of the Department of Oncology at the Jewish General Hospital.
Introducing Bryan Adams Radio on iHeartRadio. Hosted by Bryan Adams himself.
Join me for an insider look on a wild ride through 40 years of global rock and roll.
Bryan Adams Radio. Now available on the free iHeartRadio app. Or ask your smart speaker to play Bryan Adams Radio on iHeartRadio.
Who's ready to rock?
Everywhere I go, kids wanna rock.